problem. So today we're going to have Dr. Tripoli talking about telehealth, and then if we have time afterwards, we're going to have a practice session where we can even have one of the participants call in if you want, and you can go through the mental health Hawaii screener. I just put that in the chat, and we'll be recording this so we can prepare it for people to listen to and view who weren't able to participate. And we will take down, if you want a recording of it sent to you, you can put your email in the chat box. And we will also take down the names of those who participated from the participant list. So make sure you have your name on your picture, or you can put it in the chat box as well. So are we expecting any other folks to join?
They're probably having trouble getting on, Kelly.
Should we start?
Students will come on.
Well, it wouldn't be telehealth if you didn't have technical problems. So, that's all part of the game. I'll go ahead and get started, and thank you for your time today. I know a lot of you have already seen, I went through sort of a mini version of this a couple weeks ago. So some of it may be redundant, and we'll just try to flash through those parts. But feel free to stop me if you have any questions. Just so you know, I had a lot of help doing this. Didn't do it all myself. Jennifer Mabuthia was very helpful in getting us a lot of stuff. And of course, Kelly's worked on it very hard. And the JABSOM Telehealth Working Group has given me some ideas. The presentation keeps evolving, and we're working on a longer 10-hour training session right now. So, any of your suggestions or feedback are certainly welcome. All right. So real quick disclaimers. I'm an independent consultant. I'm not employed by the government as of October 1st. I am on the staff at Tripler Army Medical Center as an internal medicine physician volunteer through the Red Cross. I have a business. I've been appointed to the faculty at Uniformed Services University because Kelly wrote a nice letter for me, and I have no conflicts of interest to disclose. So here we go. What is it? So, we have this, what is telehealth, but I'm going to go a little bit farther on this. I didn't finish my graphic on it. I meant to. There's a whole universe or ecosystem called digital health. And digital health involves the transfer of information from an information source to an information recipient over a technological means. So that's a pretty broad definition, but it has to do with health. So for example, a lot of people like me, practitioners, use the internet, particularly or a tool on the internet. Well, it's available on the internet and available through an app called UpToDate. Have you ever heard of that? UpToDate. UpToDate is it's a professional database that gives you information. So if you are seeing a patient and you're not quite sure what drug to prescribe or what to do or whatever, you can just go to UpToDate and check. That's a form of digital health, but it's not telemedicine. So anyway, telehealth, you could read it. It's a collection or means of enhancing care, public health, and health education delivery and support using telecommunications. And telemedicine is the use of telecommunication technology to support evaluation, diagnosis, and or management by healthcare providers. Now, teleconsultation is a little bit different. Teleconsult can be between a doctor and another doctor, between a nurse and a doctor, between a doctor and a specialist, or you can have the patient in the room and be seeing that patient through telehealth with a specialist on the other end. There's also telementoring, where, and this gets into the issue of synchronous versus asynchronous. So right now we're all together synchronous, but there are lots of examples of where I might be a practitioner in a remote place. I send information somewhere. This is, for example, what happens with the Tripler Army Medical Center's Pacific Island Healthcare Program. And then later on, somebody will evaluate that information and send it back. So that's asynchronous. And of course, distance education is a form of mentoring. We've talked about these other things. I thought this was interesting. You know, we're talking a little bit about bandwidth, and this is the Hawai'i telehealth survey that was done. And the number one barrier was internet connectivity. You've already said that, you know. Also training how to do it. So we're addressing number two. Number one is a technical issue that there are some ways of getting around that. And I'm going to talk a little bit about that as time allows. And then you can see the rest of them here: funding, workflow challenges, and licensure issues. When we talk about training, so you notice the number one thing that pops up there is training for patients. So I do telehealth consultations fairly regularly, and the ability of the patient to be able to do this stuff is somewhat limited. I'm going to show you the platform that I use through a program called Signify Health a little bit later. But I've also noticed, and you know, because I'm a person of an older generation, I can say this without offending a lot of people, but there's sort of a generation gap as to how people can use this technology. And then there are these other issues here that we may get into a little bit. And certainly this particular training session is designed to try to help you get over some, but not all of these things. So what are the familiar conferencing platforms? Well, right now we're using Zoom, and that is a popular one. There's one called Doxy.me, and then there's others: FaceTime, Skype, Teams, etc. Now, I'm going to get into the whole HIPAA business, and that's what this asterisk is for. There's been some there's some requirements around HIPAA that are changing. So just to remind everybody, HIPAA is the Health Insurance Portability and Accountability Act. Within HIPAA, there are certain privacy stipulations. Those privacy stipulations extend to basically providers, people who are providing services. But if you use a platform to provide services, for example, a video platform, then under the HIPAA law, you are supposed to have an agreement with the company that provides that platform, called a business associate agreement, in which they agree to abide by HIPAA rules. That requirement's been waived for the coronavirus, but it may and probably will. That waiver may expire on January 1st, and so there's an issue there that we'll talk about. So we already talked about this. People are not really tech savvy a lot of times, and you have to walk them through it. So part of telemedicine is actually teaching people how to use it. I've had a lot of patients say to me, "Why can't we do this over the phone?" It's an interesting question. We've practiced medicine over the phone for a long, long time, but there's some reasons to use video, and we're going to talk about those. So poor internet connectivity, at least in Hawaii, that's a big one. We were just talking about that before we started. The survey did a map of where the connectivity is bad. I was actually kind of surprised to see that a lot of Oahu had that problem. So it's not confined to just the just the islands with a smaller population. There's connectivity problems everywhere. So we talked a little bit about HIPAA. It's business associate agreement with a provider. I went out and actually asked Microsoft, Zoom, Google, but not FaceTime, for a business associate agreement. Microsoft provides one, and they actually send you to a website, and you just download it and you've got it. And so all the Microsoft products are certified as HIPAA compliant. Zoom and Google, but you have to be a subscriber. Okay, you have to pay for it. If you're not a paying customer, then they don't certify. Zoom and Google will provide one, but you have to ask for it. And I've asked for it, and I got one from Google, but I have never heard back from Zoom. FaceTime will not provide one, and there's some information out there that they justify it that way, and the VA has said that they don't need one for FaceTime. So we'll have to see how that argument develops over the next few years. So we talked about synchronous and asynchronous. In addition to that, a lot of you probably have, well, some of you may have a health plan where you have a portal to message back and forth with your provider. So that's another form of asynchronous telehealth. It's basically secure email. Teleradiology is another form of asynchronous telehealth. We don't think of it that way, but a lot of radiologists read films from their
Bless you.
Sorry, I had to sneeze and I tried to turn it off, so we'll have to cut that out of the recording. Sorry. Don't worry, I don't have COVID. And even if I did, you can't get it on telehealth. So teleradiology, a lot of radiologists do remote readings. And we've talked about the interprofessional stuff. Remote patient monitoring, RPM. That is a growing area of telemedicine where you're monitoring a patient's status. So the patient's vital signs may be coming over the line and being monitored continuously by technology or by AI. Blood glucose monitors are now working like that. I just got this scale. I step on it every morning and it tells me that I need to lose weight. But it always has the same answer. But it sends the data to my cell phone via Bluetooth. Now I can, if I want to, share that data with my healthcare provider, but I don't want to, because then they'll tell me I need to lose weight. But you know, a lot of people have sleep apnea and they have a CPAP machine, and almost all the CPAP machines these days connect to a phone, or they connect directly to the internet and give the data to the provider, so the provider knows whether the CPAP is being effective. And that's a form of telemedicine as well. So we talked about these. There's video plus audio, there's the good old phone, and then there's online portals. So people ask, you know, doctor, can I send you an email with my privacy data on it? And I say, yes, you can. I don't recommend it because patients are not covered by HIPAA laws. Only providers are, or healthcare workers, or people who have associate who work with the healthcare workers. What I mean to say that is, if you want to share your social security number with the world, you can go ahead and do that. But if you're a provider, you can't do it with other people's data. So there's a couple of synchronous telemedicine models out there. There's sort of a hub and spoke facility. So how this works is that, and this was the sort of pre-COVID construct more often. So what happens is the patient actually has to go to an office, not their home. So this is where a patient goes out to a telemedicine office, and usually there's a person there who helps facilitate the meeting. And I'm going to go through that a little bit. So the notion that telehealth is at home has sort of evolved around COVID. Prior to that, people pretty much had to go somewhere to get telehealth. And then there are instruments that are used to monitor the patient. For example, remote stethoscopes and things like that. There's also a direct-to-consumer type, and that's where we use things like Zoom and Skype and Doxy to go straight into the home. Okay. Various telehealth roles. So I have a number of roles up here: manager, provider, coordinator, facilitator. not everybody has the same role in telehealth. And I have a document which Kelly and I can share later, which goes through the various roles. And I could put it up on the screen, but basically, instead of reading you the whole document, it goes through what a medical director does, what a site coordinator does at the patient site, what a site coordinator does at the specialty site, and those are a little bit different. And then what an instructor does, we have up there, a clinic manager, so you see the manager, of course, and we also have obviously a provider, which is a little bit different than a medical director. And one of the most important actors in the whole thing is the technician. I have the technician over there, but he's hidden by my, there it is, the technician. Looks like a welder. Each of these roles is different. And I think as we go through our presentation to AHEC scholars, they'll all fall into different categories on this. And part of the longer program is to go into a deep dive in all of these different roles. So if anyone has any questions about who does what, please ask. We're going to move on to really kind of work through one side of this, which is the direct-to-consumer telehealth. What we're not going to do in this particular discussion today is to talk about this hub and spoke type of telehealth program. Welcome. Okay. So, there are some potential clinic workflows through telehealth visits, and we're going to see some of this today. One of them is an on-demand, like a walk-in clinic. So you can set up a telehealth virtual office, and patients come in and out. Now, there's some technical issues there that we need to be aware of. You don't want somebody walking in on somebody else's visit. So the way that that's done is through various technological means. When a patient, in certain platforms that are used, if a patient wants to enter the room, you can restrict access. So you'll notice in Zoom today, right? Zoom, you can set the settings to have the same Zoom meeting every time. And that's what Kelly did with these lectures. So each time that we do these lectures, you're going to have the same Zoom URL. And as you see at the bottom, the URL doesn't change. It's a personal meeting room, right? So how do you keep people from walking in on a visit? Well, you notice when you go into Zoom, there's an option to set it so that the host has to admit you to the room. And you'll hear a little doorbell ringing. So that's a way of preventing people from walking in on the visit. But you got to be careful to make sure that you set it right, because if you don't do that, people can just go in and they'll be in the room listening to you take care of other patients. Now, the scheduled patients, what you normally do is you give them each a different meeting URL. So again, those of you who are familiar with Zoom, you'll notice if you have a Zoom account, you can set up a personal room and just use that same URL each time, or you can set up a unique meeting ID and use it on a once only basis. And there are ways to actually overlap visits where you can do some screening or whatever, before the patient arrives. So I don't know if you heard, but I just heard someone trying to ding in, and Dr. Withy is admitting that person. I'm not, as I say, that on this particular discussion, I'm not going to get into a whole lot of what is on the sensing end or the patient end. There's a lot of different things out there, which are otherwise known as telemedicine carts. I think a number of you know what those are. But we need to, in the interest of time, what we're going to do is just focus on the ones where we're using a low-tech approach without a lot of that equipment. Now, regular old phone. So you could, if you wanted to do a telehealth visit, you could take this piece of technology right here and just use it however you want to. Now, you notice this particular piece of technology dates from the 1930s, but it still works. And you could potentially use this to conduct your telehealth visit. However, most people like to have a phone that does other things, like take pictures. I can assure you that this particular piece of equipment does not take pictures. And of course, there's been a lot of advances in the bandwidth that telephones and tablets have these days. So what about software? All right. So there's various software packages that come with telehealth. Today, we're just going to do the video conferencing platform. We're not going to, I am going to show you an example of the package that I use, and it comes with an electronic medical record. Again, the issue of HIPAA compliance, I'm going to get back to that. Now, notice recording, we're recording this particular conference today. However, in general, you don't record telehealth visits without a patient's consent, but you can and probably should do some screenshots of various things, particularly things like dermatology, where you're trying to look at a lesion. And of course, then we have what are called leave behinds. So these are documents or handouts that you provide as part of the visit. This is done regularly in most office visits anyway, but with telehealth, these things have become more and more standardized. And I'll get back to the electronic health record aspects of this. So what about sharing the telehealth data with other providers? Say you want to share a visit. Well, all you can do is share the medical record. So we're going to come to the medical record part of this in a minute. Before I go there, there's some things that I think are important to get started. So the computer should be at the level of your head. So you notice my head is in the middle of the screen here, or at least it's supposed to be. And you can see the background that I have is a background that I chose. This is my office, but it has a couple of diplomas and a microscope and a phone and some books, and it kind of has the look that someone might expect from a physician. But let me just tell you this: I have actually been, interestingly enough, on a video conference. This wasn't a telemedicine conference, but it was a video conference, and a doc was joining. And she was sitting talking on the screen, and directly behind her was another doctor looking at a CT scan from a patient. And you could actually see the information on the screen, so that's probably not a good backdrop. And we're going to talk about some of the other backdrops that can be distracting. Now, the question is, should you wear a white coat if you're a provider? That's an interesting question. Some people say, no, you shouldn't. And others say that you should. And so when I work for Signify, I actually do wear a white coat because they recommend it. Now, the issue of lighting, okay? So what I've done here, and I hope it's lit reasonably well, is that I have light coming at me from this direction. There is some light behind me just so that you can see the background, but most of the light is coming this way. And we're gonna show you a little video about that too. Of course, having your cell phone ring and some other things are going to be a problem. And so you need to think ahead of time. Also, too, before I have a telehealth visit, I usually call the patient the evening before. I walk through all of the things that they should expect and get any questions they have. So it's not just, turn on the machine and go. Now, you may have a clinic where this is organized by somebody outside, somebody who's not the provider doing it. And it's very important to have that backup means of communication, to be able to have a phone that if the connection goes down, you can reach somebody. Or say something happens during the telehealth visit where the patient needs some help or has an emergency. Those things you need to have some contingency plans for. So what we have with Signify is that we have a hotline where if something goes wrong and patient needs help, we send a case manager out. I'm going to go and do a little video here. There's some really nice videos that the Hawaii State Department of Health has done. And I'm just going to run a couple of those for you here. As soon as I get it to come up. Here we go. Okay, 1 second. Now, when you're sharing stuff, remember you need to turn on the sound. Where did that come from? Sorry. If you want to use the sound, you need to be able to turn it on. Okay, almost there. Not that calendar. This goes to show you what can go wrong. Hang on 1 sec. I just got to get out of the PowerPoint show real quick. There we go.
Aloha.
All right. It shows you the need to really get to know how the system works before you start using it, because there are little glitches like that.
Aloha. The purpose of this video is to give you some basic tips about how to conduct a telehealth session using best practices. First, let's talk about your environment. What is behind you when you're on camera? It's best to have no doors and windows behind you, as they can be distracting for patients and could cause an interrupted session. A blank wall that is a neutral matte color works best. If you have any shelves visible, make sure they are not cluttered. You can always pull a screen or curtain across a door or wall to hide what's behind it. We want your surroundings to look professional. How is your lighting? Make sure what is seen on camera is well lit. No one wants to see a shadowy figure giving them information. Use extra table lights if necessary, since fluorescent overhead lights are not flattering. Try not to have a window or other light source directly behind you, as it will cause you to be backlit and make it difficult to see your face. How is your equipment set up? Just like an in-person visit, it's good to make as much eye contact as possible during a telehealth session. To simulate this, you may have to raise your laptop, tablet, or monitor with some books so that the webcam is positioned around eye level. Before each session, make sure that your face is relatively centered within the screen so that the patient is not just seeing the top half of your head. You may also want to use a noise-canceling headset if there might be any ambient noise around you. If there is a chance that someone might walk into your room while you are doing sessions, remember to put a sign on the door to not enter. Try to reduce sounds from others, including children, pets, cell phones, and other distractions, as much as possible. It's always good to look professional, especially on camera. Limit wearing patterns, as they can be distracting. Don't wear noisy, big jewelry, and check to see if there is any glare off your glasses. Many people who do telehealth also wear a lab coat during appointments. Much like an in-person appointment, please do not drink or eat during sessions. If you are going to be using your mobile phone or a tablet, make sure you are not holding your device in your hand, as you will appear shaky to the patient. Do not move or walk around with your device to avoid having your head bob around. It's best to use a stand to make sure that you're stable within the video. Now, let's talk about patient interaction. Since most telehealth sessions are with people you have not met, make sure to introduce yourself and the purpose of the appointment. Some providers even put a sign on the wall behind them with their name. Then make sure to have the patient introduce themselves and tell you if there's anyone else in the room with them. Sometimes you can't see who else is off camera. Make sure the patient can see and hear you well. Ask them at the start of the session. Adjust the camera to maximize eye contact. Whether you're new at this, have done a lot of telehealth previously, or just logged out of this system an hour ago, before you start a new set of sessions, you should always test your connection to the platform. Make sure your internet connection, microphone, and video are working. It's better to troubleshoot before you're on with a patient than during a session. Ending the session. Remember to reiterate your recommendations to the patient and provide documentation for your records and the patient as needed. If you can, try to give the patient information about who to contact if they have additional questions. Finally, check that you have successfully logged out of the session completely.
So that's one of the things you definitely want to be careful of, is to make sure that you've disconnected from the meeting. There's nothing more embarrassing than to be making offhanded comments when you think nobody's listening. One of the other stories that I think is kind of funny is that I was doing a telehealth visit on a patient a couple of days ago. And even though you shouldn't eat or drink, again, like HIPAA, this guy was eating breakfast and he was shoveling it down. And our visit went on for an hour and 15 minutes because he had a lot of issues, but he just kept eating the whole time. It was making me awfully hungry. So it just, again, though, it's probably not a good idea for you, the practitioner, to be doing that. I'm going to show a little one by Dr. Tanya Elliott. Dr. Elliott is someone who's been promoting telemedicine for a while, and she has a couple of tips. Again, these are YouTubes that are available out on the internet. So let me get Dr. Elliott up here, and we'll have her give us a few of her pointers.
Hi, I'm Dr. Tanya Elliott. As some of you may know, I've seen over 7,000 patients through video visits, and so I'd like to think that I've started to nail down the key aspects of having exceptional webside manner when I interact with patients. So this takes some practice and getting used to, and I've taken a lot of patient feedback in and trained a lot of doctors on how to have exceptional communication skills through this modality of video consultation. Now, it's different from what we're taught in medical school when we have standardized patient examinations and you're doing this in the office. It's just a bit of a different setup. So first things first, in terms of setting up an appropriate background and setting the stage for professionalism. I recommend, if you wear your white coat in the office, which I often don't, but if you do wear your white coat in the office, feel free to go ahead and wear your white coat for the video encounter. However you dress, whatever your professional dress is for the office, whether you wear a dress, a shirt and tie, if you wear scrubs, do the same thing for the video consultation. In terms of a background, you can have a white wall that's perfectly fine. It might be a little bit bleak, so you may want to put a painting up behind that, or perhaps a bookshelf. That's perfectly fine as well. One thing you don't want to do is be directly in front of a door. Studies have shown that when patient sees a door directly behind the practitioner, they feel a sensation that the doctor wants to turn around and leave right away. And so you want to avoid being directly behind a door. It's okay to have a doorway way in your background like I do, but you don't want to be directly in front of a door. Also, making sure that your face is perfectly framed up within the middle of the camera. You don't want to be like this, talking to the patient. You don't want to be like this, talking to the patient. You don't want to be over here. You don't want to be over here. So making sure that you're the appropriate distance. Right now, I'm approximately 2 feet away from the camera. So again, making sure your face is framed and doing a video test beforehand so that the patient doesn't have to wait while you properly position the camera. The next aspect is eye contact, and this can be really challenging because when you're talking with a patient through video, you want to be looking directly at the patient. So right now, I'm looking, quote, directly at the patient. I'm looking directly at myself. However, I'm not making eye contact with them. I was not making eye contact with them. I actually have to look directly at the lens of the camera in order to make eye contact with the patient. So it's a little bit counterintuitive. Our eyes often shift to either look at ourselves or to look at the patient directly, but the patient isn't perceiving that you're looking at them directly. So make sure that your eyes are parallel to the lens of the camera. That's how you make eye contact through a video visit. And it makes a big difference. Your eyes, your facial expressions, all of those things are more exaggerated when you're on film, when you're on camera. So just make sure that you have nice, warm, kind eyes. You're looking directly at them, and by directly at them, I mean looking directly at your camera and initiating the consultation that way. Another thing that helps set the stage for a video consultation is to ask their permission, to ask their consent. So if it's a new patient, you introduce yourself. Hi, I'm Dr. Elliott. It's nice to meet you. And then the next section is, do I have your permission to treat you through this video consultation? Setting that up is tremendously important because both for the doctor and the patient, this entire encounter is new. And so you want to make sure that you frame it up with the same level of respect and professionalism that a patient experiences when they walk into your office. Okay, so we've checked off background, dress and professionalism, how to frame up the camera, and then we've started to talk a little bit about communication skills. So making eye contact with the camera, again, tremendously important. And then making sure you're keeping your facial expressions in check. Remember, everything is exaggerated on camera. So you may be scowling, you may be making a certain face, you may be looking away, and all of those things are exaggerated when you're on video. So just keep that in mind. Now, oftentimes when you're doing a Zoom or a FaceTime or any video modality, you actually have a little cheat sheet that you might not have been aware of, and that's your face in the upper or lower right or left-hand corner. So every now and then, while you're doing the encounter, glance over at your face, just give it a bit of a reality check, make sure you're not making any funky facial expressions, and leverage the fact that you can see yourself and get real-time feedback during the encounter. It's tremendously helpful as you continue to hone your website manner skills. The next thing that's very important is your clinical documentation and at what point you do that during the encounter. If you decide that you want to do documentation while you're interacting with the patient, that's perfectly fine, but let them know that you're going to be typing while you're interacting with them. So I'll often say to the patient, you may hear me typing right now, and that's because I want to make sure I get down every detail of what you're explaining to me. The reason that's important is the patient can hear you typing. So if you're going and clicking while the patient is talking and you're clicking and clacking on your computer, it can be very distracting to the patient. But if you let them know up front and you set those expectations up front, it oftentimes is perfectly fine. Or the patient may say, oh, I prefer that you don't because it's distracting to me, which is okay as well. But again, setting those expectations up front is very important. Now, the other piece is having multiple windows open. So some doctors will have 2 computer screens up and they're looking back and forth between the 2 screens. And some doctors have multiple tabs up so they can be typing and talking with the patient and then looking away because they're looking at another tab on their computer screen. Again, it's perfectly fine to do that and to look away and even look up something while you're on the consult with the patient, as long as you let them know. So I will let my patients know, just want to make you aware that I have 2 computer screens up right now. So if you see my eyes darting away, it's because I have your patient record on one side, and that's what I'm looking at when you see my eyes move over here. And then of course I want to make sure that I make eye contact with you. So letting your patients know that, or letting them know that perhaps you're looking up the most recent guidelines, all of those things are completely appropriate, well received by patients. You just want to let them know that you're doing that up front. Again, all these nuanced things that are slightly different through video, so you want to just go through this journey together with the patient and set those expectations up front.
I cut her a little bit short because we are going to cover some of the other things that she talked about in a little bit later. So what we have here now is a example of this is kind of fun, and I think some of you may have seen this one before, but it's an example of what you should not do. So what I'm going to do now is switch to this guy, and of course, you know, this is all acting, but it is in a sense, you know, an example again of the wrong way to go about it. So without further ado, let me get started. Like one of those
hello.
quiz things to see if you can spot all of the things that he does wrong. You know, like one of those things that has a picture here and a picture there, and you try to spot the differences.
Yeah, just give me 1 minute. Let's see here. Ray Barrett. And your date of birth? Okay. Okay. All right. So it's good to see you today. And can you hear me okay? Excellent. Yeah, so what brings you in today? All right. Hold on, let me jot this down. All right, let's see here. Oh, gee, hold on. I'm sorry, give me 1 second. Hello? Yes, I'm in a session. I'll have to get back right with you, okay? I'll give you a call back soon. Okay. All right, and your number? Okay. All right. Yep, I'll call you back in about 10 minutes. All right, thank you. All right, so where were we? Okay. Yes?
Hi, do you have the report for me? I was gonna send it out.
1 second. Yeah. Okay, there it is. And,
Okay, and it's all set?
it's all ready for you.
Okay, great.
All right, we'll talk
Do you
about
need
it soon.
anything else?
No, I'm all set.
Okay.
I'm good.
Thanks.
All right, thank you. All right, let me shut this door. All right, so here we are. Again, sorry about that. Let's get started here. Yes, so Ray Barrett, excellent. How can I help you today?
Marley, come on. Come here, girl.
So as you can tell, obviously that would be something that you might not want to do. Everybody notice the pants? So one of the things that people often ask me when I'm on telemedicine is, are you wearing pants? Yes, I'm wearing pants. Always wear pants. Okay, so, or some other appropriate garb. So a lot of times people will ask, what about a physical exam? Can you do a physical exam by telehealth? And the answer is that yes, you can. And for that, I'm going to turn back to Dr. Elliott again, and we're going to listen to her talk a little bit about the physical exam.
I'm Dr. Tanya Elliott, and I'm going to walk you through how to do a physical examination through telemedicine. So it was William Osler that said that medicine is all about the art of observation. So the first thing I do after I connect with the patient and consent them to do the video consultation is evaluate their general appearance. Are they ill appearing? Do they have pallor? Are they diaphoretic? Are they flushed? Then if I feel like I need vital signs, I ask them if they have a thermometer at home, and just to go ahead and take their temperature to show me what the reading is, and then I can document what the result is. Some patients also have a home blood pressure cuff, so that's another thing I'll ask them to go ahead and get to take their blood pressure and pulse if it's relevant. If patients don't have one and there's somebody that you see chronically and you'd like to have that as a regular vital sign, you can just ask them to go ahead and pick up a straightforward blood pressure cuff and then show you the result on the reading, and you can document that. Respiratory rate is something that you can calculate as the patient is speaking with you. Next, let's do the head, ears, eyes, nose, and throat examination. So is the head normocephalic and atraumatic? Next, look at the eyes. Are the pupils equal and reactive to light? You can ask them to look up, down, to their left, to their right, diagonally. And with that, you're also documenting aspects of a neurologic exam. You can actually do a cranial nerve exam as well, with the exception of the olfactory nerve, which is often also deferred in the office as well. If you want to look in the back of the throat, have them open their mouth, stick out their tongue, and do a big ah into the camera. If for some reason you can't see, you can ask them if they're on their smartphone to just adjust their angle. I also sometimes will ask patients to grab a flashlight or use a flashlight on their smartphone to be able to see down into the back of their throat. We can also evaluate the sinuses. I tell my patients, okay, now you are going to be my hands for me. Take 2 fingers, tap here, and let me know if there's any pain. Use a moderate amount of pressure. Same thing here and here. Let me know if there's any pain or any difference on either side. And then I can document whether or not there's any maxillary or frontal sinus tenderness. Now again, the only difference then when they're in the office with you is the patient is being your hands for you, but the response is still subjective, and you can document that on your physical examination. The next thing I ask patients to do if I'm concerned and I need to evaluate for lymphadenopathy is I teach them where the sternocleidomastoid is on either side of the neck. Take 2 fingers or 1 finger, depending on how big their hand is, and feel for something that's pea-sized or greater down the anterior and posterior chain. Now, sometimes patients get this, sometimes they don't. However, if it is a large lymph node, they should be able to feel it, and then they can actually show you exactly where it is and whether or not they can grab onto it, whether it appears to be mobile or fixed. I also will ask them to feel here and here to evaluate whether or not there's any submandibular tenderness. The next piece is the respiratory exam. Now, a lot of times doctors will say to me, well, you can't do the respiratory exam because you don't have a stethoscope. Well, there are aspects of the respiratory exam that you can do through a video visit without a stethoscope. So first thing I do is ask my patients, take a big deep breath. Now, I see whether or not they're coughing in the middle of that. I see whether or not there's an expiratory wheeze, whether or not that's relevant for you and in the context of the patient. I also evaluate whether or not the patient is using any accessory respiratory muscles for breathing. Nasal flaring, use of any neck muscles, any paradoxical breathing where the abdomen is moving differently from the way that the chest is moving. And then all of that can be documented. The next part of this video series, I'll walk you through how to do an abdominal exam, extremity exam, and musculoskeletal.
So, of course, in the interest of time, I'm not going to show all of them, but just to give you an example as to what you actually can do on a low-tech video exam. Now, there's a lot of controversy about that, and I'm not sure every one of you wants to be doing a physical exam on telehealth, but what I'm trying to get, the point that I'm making is that it is possible to do a certain amount of physical examination screening while you're on the telehealth visit, even if it's a low-tech telehealth. So a lot of people these days have a watch, and my watch here, this is the Apple Watch. I don't know if you have one, but it does take your pulse. It even does a EKG if you wanted to. I didn't realize it, but my phone had a little app on it the other day, and it asked me if I wanted to take my oximetry, and my phone actually has a built-in oximeter, and I didn't even know it had it. Of course, the respiratory rate's pretty easy to observe. A lot of people have home blood pressure monitors as well. And of course, asking someone their height and weight is something that most people have. The other thing you can do is you can evaluate orientation and alertness. You can do some child developmental assessment. Skin rashes are something you really can do, or skin lesions, and a few eye and mouth issues that Dr. Elliott talked about. And I thought it was kind of neat that, you really can get people to put the phone up pretty far. One of the things that I always ask is to show me your knuckles. And, you can do a lot of diagnosis just looking at people's knuckles. A lot of older people have arthritis, and you can do a pretty good judgment as to what kind of arthritis by looking at their hands. Medical records part of this, I'm gonna actually go to a video on this, but we've already talked about doing some photographs and things like that. So I mentioned to you the company that I've been doing work with is called Signify Health, and they have a new HIPAA compliant platform. And I think it's really kind of neat, and I'm not trying to do a commercial for Signify Health. What's good about this one, and working with another company that has another one, is that you can use very low bandwidth to get really good results. So let me just see if that video will show.
The COVID-19 pandemic has changed a lot of...
Can you hear that? Okay.
The COVID-19 pandemic has changed a lot of how we do things. At Signify Health, we improved our telehealth experience by creating a HIPAA-compliant solution that could meet the needs of our health plans now and in the future. Introducing Signify Health Virtual Assessment, now with integrated video. Our new HIPAA-compliant solution streamlines the experience, making it easier for the clinician and member to connect virtually. Assessments are completed with any device with a camera and internet connectivity. That means members can use their device of choice, whether a mobile phone, tablet, or computer. Connecting to a virtual visit is simple. The member simply goes to signifyvideo.com, clicks on Check In Now, and enters their meeting code and phone number to join the video call. The virtual visit is designed to mimic a face-to-face experience. The video stream is embedded within the member's record, allowing clinicians to see members' nonverbal behaviors throughout the visit. Clinicians can observe the home environment while assessing for social determinants and also view prescription bottles to enhance medication review. They can also clearly see members to complete comprehensive documentation in support of health plan objectives. Let's see what that might sound and look like with a short simulation of a clinician and member.
Hi, Mrs. Smith. I'm Dr.
Yes.
Higgins. I'm glad we were able to connect here today.
Yeah, nice to meet you.
Can you see and hear me okay?
I can. Can you see and hear me?
I can. Great, let's begin the assessment. I'm going to ask you a few questions about your health over the next 30 minutes, and I'll be able to answer any questions or any concerns that you might have. Are you ready to begin?
Okay. Yes.
Excellent. Let's get started. Going over some of your information here. Can you verify your address for me?
Sure. It's 4420 Harper's Ferry Drive in Grand Prairie, Texas, 75052.
Okay, excellent. I see you've had some problems with chronic pain in the past. Is that still an active condition?
Yes, I still do have pain in my shoulder.
Okay, which shoulder is it?
It's actually my left shoulder. And it's a little bit towards the back. It tends to bother me when the weather changes or if I sleep on it funny.
Okay. What are you currently doing for it to treat it?
I'm just taking an over-the-counter pain medication.
Okay. Have you tried any hot packs or cold packs?
Not regularly, to be honest.
Okay. That may help out as well.
Okay. Thank you so much for your help today, Dr. Higgins.
Thank you very much. Have a great day.
Easy for members, seamless for clinicians. Signify Health integrated video is completely secure and HIPAA compliant. The communication channel between the clinician and the member is end-to-end encrypted for security. Simple, safe, secure. HIPAA-compliant telehealth visits from the comfort of your couch or wherever you'd like. Now that's bringing health homeward.
So you may have noticed in that particular video that there's an electronic health record with a video embedded. So what's really good about that is that, and I like this system because I'm not just writing things down on a piece of paper or a different computer. I'm actually doing the visit and doing the health record while I'm talking to the patient. And obviously that, is not something that everybody has access to right now, but I think that that's what we're going to see more of in the future. The other thing you may have noticed is that the patient only has to go to a website. They don't have to download any software or anything at all. They simply just call up the URL. All they need is a browser. And I think that's also going to be the future of these particular technologies because fumbling with how to use Zoom or a number of the other platforms is sometimes the most difficult portion of the compliance and the ability for people to use telehealth. And I think one of the things that we have to be cognizant of is that it's not just because COVID's going around right now. Oops, sorry. It's not just because COVID's going around right now that we want to use telehealth. There are other reasons to use telehealth, which I think are important. And one of them is being able to reach people who are in remote locations where they may not have the opportunity to come and see the physician on a regular basis. Sorry. Oh, I'll get it right this time. I apologize here. Just need to hit the escape button. There we go. Okay. All right, back to the slideshow. Here we are. Okay. So, as I said, sharing the information with the patient, if you have an electronic health record and the patient then has a portal to it, it can help you get there. There's also a way that you can do some file sharing or types of downloads through particular portals. So for example, Microsoft Teams is one of those portals that has access to file sharing as part of the program. And then of course, HIPAA compliant email is another one. This is a busy slide, but I wanted to just sort of walk you through some of the things that are temporarily easier right now during the COVID pandemic. CMS has made it easier for people who are enrolled in government services, including Medicare, Medicaid, and CHIP, to receive medical care through telehealth during COVID-19. And they broadened, sort of relaxed a lot of the privacy law stuff around it. And in addition to that, Medicare and Medicaid and the federal government programs have allowed providers to charge for it, to bill for it. There's no guarantee that they're going to continue to do this after we get everybody vaccinated, but we're all hopeful that we don't lose ground that's been gained during the pandemic. Now, I don't want to say that I'm a fan of the pandemic. I wish we had never had it. I'm sure all of you do too. But there are some things that came out of it out of necessity, which have helped move forward in this area. Okay, so how can you get in trouble doing all this? Well, as you might expect, the lawyers are latching on to telehealth now and learning how to sue. there's been relief from a lot of lawsuits because of the pandemic emergency. There's been medical liability that has been relaxed for all, during this period of time. However, I wouldn't expect that to last either. So for one thing, some malpractice insurance carriers do not cover telehealth and make the system pay for a supplemental insurance policy. So that's something that if you're going to engage in telehealth, you need to think about. Consent. There's a patchwork of regulations all across the states about whether you have to have a written consent, a verbal consent, how that consent is obtained. And then informed consent for telehealth typically involves a discussion about it. But when you try to explain what HIPAA is to a patient, that can take some time. So it's important to understand that that's all part of the setup. Then there's some ethical considerations that have come up. So remember, I talked about, people of certain age groups are more in tune to technology than others. Also, we talked about bandwidth in the Hawaiian Islands before this conference, and then we talked about it at the beginning. There are certain neighborhoods in places that have poor bandwidth, and there are a lot of people who don't have things like smartphones and that sort of thing. So there are some discrepancies, I guess you could say, about who can use telehealth and who can't. Again, billing is a long discussion that I won't get into right now, but if you have a system where you depend on billing for your revenue, it's obviously an important discussion to have. We can't go into detail of that right now. So prescribing, there's been e-prescribing for a while. There are rules around that. And then of course, remote medication delivery, mail order has been around for a while. One of the things that's growing is e-pharmacy, where a pharmacist might be able to provide advice to patients. And in the clinic at Tripler, we have pharmacists available for consultation. Setting up a pharmacy consultation is even by telemed is a good idea and something you should think about. And having said that, there are other services, obviously behavioral health, counseling, dietitians, all sorts of things that you can do via telehealth that you don't need to do a lot of in-person discussion. I mean, in-person, hands-on with. Okay. We've covered a lot of this already, but one of the things that I talked about before was the telephone for first pass screening. So make sure they don't need to go to the emergency room or urgent care instead. There are some things that are not appropriate for telehealth, obviously. Does a patient need testing that's not available in the clinic? And is this a problem that can be handled just by telephone? Do you need to really get somebody on to go through the whole process of being on the video if all you could have to do is really just talk to them? And of course, do they have the right equipment, which we've talked about? So it's not for every situation, which I said, and we've talked about these as well. You can't do the whole physical. Older people sometimes are concerned about it. Legislation and payment barriers. Is the information hackable? I think anything's technically hackable. And, the question is, how much do you have to worry about it? The American College of Physicians has a nice program, which actually you can access for free, that really goes into a deep dive on telehealth, including a cost-benefit analysis, which again, I don't have time really to go into all that at this moment, but there is one aspect of this this program that I think was pretty neat that I wanted to go over. Now, Kelly, we're at 1 hour. We're at 1 hour right now. Is that right? Or how long have I been talking?
You've been talking an hour.
Yeah. So, so what I thought we would do at this juncture is to see if we could segue into a little bit of a practice session rather than more on the PowerPoint. Would that be okay with you?
That would be great. How about if you go to covidhawaii.info and
Yeah.
you can share your screen,
I will.
and you'll see a screening. So this is actually an online screening, which can end in a telehealth visit. So we
Right.
will,
All right, here goes.
okay.
Let me just get the screen share up here and off we go.
So
There it is.
you are being the patient.
Right.
All right.
Okay. So I'm gonna first of all, here's the website, and we're gonna you can use this website as Dr. Withy has said to schedule an appointment to discuss COVID. So what I will do is I'll click here to schedule an appointment, but understand there's a lot of other stuff on here which is very interesting and really good resources. But I won't go into all of that right now. But it's covidhawaii.info.
Info, yeah.
Yep. Okay.
Okay.
So now we're going to have a video over a video, which could be a little bit of. So I'm going to select Hawaii.
Okay, let me put myself on.
Okay.
Do you
There
see
it
me
is.
there? So,
I do see you. All right. So do I hit schedule session or what?
yeah, go ahead.
All right.
Or, oh, you know what? Let me turn myself on and you can say meet now.
Yeah. Okay. Yeah. I might have to just refresh my screen real quick here.
Okay, and I may as well. So settings. Apologize. Okay,
Yep.
go ahead and refresh.
All right. Okay, online now. There we go. So I hit your name, right?
Right. Well, hit meet now over to the right under view full profile.
Oh, yeah, there it is. Okay, got it. There we go. Okay, so then I have to put in my stuff, which I will do.
That's fine. Doesn't matter.
Thought I'd be official anyway.
Yeah.
Okay, new password. I'm just gonna hit. Oh, I can't do that. I
Well,
can't
try-
bypass it.
Well, okay.
All right.
Didn't know you had a password already.
I do have a password already.
All right, go ahead and set.
Match. They don't match. I'm gonna try again. Okay. Do we need a punctuation, perhaps? Okay. 10 characters. Eventually gonna get there. Okay. Very weak. Good enough.
All right. Oh my goodness, all kinds of information.
Yeah. Yeah. Oh boy.
Okay,
Okay. Well, I can fill it in automatically here.
Yeah,
Mm,
and just anyone.
Yeah.
111 2000.
I'm making myself younger than I really am.
It's always nice.
There we go.
Wow. Okay, sorry, I didn't know it had all this. This is good for me to see.
Well, the last time we went through it, we didn't.
Yeah.
So they must have added it.
Guess so.
Yeah. Okay. It's going to ask me for my insurance next.
Oh my goodness. I hope not.
Okay, well, that's
Yeah.
what we did.
Try
We
skin.
did, honest to God, we rehearsed this once, but it didn't have all this stuff on it then.
Just put
Oh, boy.
finish. No, just put.
Oh, okay.
Wow.
Let's see, finished. Got it. Okay, now we're there.
Now, okay, agree to that, whatever it is.
Yep, I had to move you out of the way there. There we go.
Now we're gonna have to, okay, so now you're in the waiting room.
Yep.
So it should come up for me any moment. Should hear a ding, which I have not heard yet. Oh, there's the ding, so it's
There, that sounds like a ding.
Yeah.
Either you're there or the pizza's done.
It's,
Oh,
yeah.
you know what? Now we're talking over both, so I'm going to mute myself.
So you're muted, so
Here it comes.
loading.
I unmute, but I'm going to mute myself again on the Zoom. Okay.
Mhm. So, all right, so I've approved your visit. And still nothing's happening. So this is realistic telehealth.
So one of the problems that I think we might run into, as I said, is we're doing a video over a video, which makes it hard because the camera can't do two things at once. So what I think we could do though is, you know, we've seen what the platform looks like. We've seen Signify's platform, but you and I could just do the visit right here on this Zoom, and not have to use the other medium unless you feel that there's something there that you want to show.
Well, I think I'm coming into it right now.
Okay.
It's loading.
Okay.
Start session. And these we can do with people if students or individuals want to practice. Okay, so maybe this is just showing bad bandwidth.
Well, as I said, I think our problem's going to be that it won't allow me to do two video sessions at the same time.
You are the only participant in the conference.
Well, all right. Well, I see myself and you see yourself.
No, my camera's not working. Let me see. Okay.
So one thing is I can chat.
Yep. I do see that.
You saw my chat.
Yep.
Okay. So it says, please, let's see. Well, okay.
I don't think we can do two video platforms at the same time.
We have been able to in the past, but okay. So one of the benefits is of using the platform, you can see there's a whiteboard so you can share documents or draw on things. You can send forms, you can invite people. So those are benefits of the video platform, but if you cannot connect, which we cannot right now, then it's not very practical. And so that's why a lot of people do it over Zoom. So we can go back to Zoom and pretend like you have this background on our Zoom call. So
Okay.
we can end this.
I did.
All right. And
All right. Let me go back onto video. Sorry about that.
no.
All right. we're going to have to work on that one a little bit, but this
Yeah.
is our first one, so here we
All right. Okay, good afternoon. My name is Dr. Withy. What can I do for you today on this video call?
Well, hi, Dr. Withy. The reason that I set up the appointment was to check to see whether I have COVID.
Okay, let me just let you know a little bit about telehealth first. So, of course, I'm not seeing you in person, so I won't be able to do your physical exam. But telehealth is a connection over video where I will do my very best to assess and advise you. Is that okay?
Yes.
Okay, is there anybody in the room with you that I should know about?
No. Now, let me step out of character for a minute. Every time I've done telehealth in Hawaii, there's always been 65 people in the room. And you know, so let's say that I said, yeah, my kids are running around right out here. What would be your reaction to that?
Is it fine with you if we talk in front of them?
Oh, sure.
Okay. And I have, stepping out of character, had a lot of people do their visits from their car because that's the only place that they can be in private and have air conditioning at the same time. So luckily they're usually pulled over at the side of the road, but they are in their car. Okay, so you did some screening online and I see that you have a cough and a fever and some body aches.
Yes.
Can you tell me how high that fever is?
It was 101.5
Okay, and when did you start getting these symptoms?
yesterday.
All right, have you been around anybody who has COVID?
Well, not that I know of, but I was at the bar about last week, and you know, a lot of people weren't wearing masks, and you know, it was kind of crowded.
Okay, well, let me ask you the most worrisome symptoms, and these are things that you'll want to watch for if you do have COVID, because these are indicators that you would want to go to the hospital. So, are you able to breathe comfortably?
Yeah, I'm pretty good there.
Okay, and
There
do
was a
you-
lot of smoke at the bar.
I understand. And are you able to get up and walk across the room without trouble? You don't need to do it.
Well, I have some arthritis, but it's no worse than before.
Okay. And do you feel any cloudy thinking? Do you feel like you're dizzy or disoriented in any way?
Well, I don't think so, but my wife always says that I do, but that's nothing new.
Okay, well, if she tells you you're more disoriented, that would be something to worry about.
Okay.
Have you had any changes to your sense of smell or taste?
Yeah, food doesn't quite taste the same to me.
Okay, any sore throat or congestion?
Yeah, I've got a little sore throat. It's just been kind of scratchy for the last couple of days.
Okay, how about vomiting, nausea, or diarrhea?
No, none of those.
Okay, and you haven't noticed any blue coloring around your mouth or your fingers? All right, can I see your fingers? And turn them over? Very good. Okay.
They're about the same as before.
Okay, good.
I cut back from 4 packs to 3. No, I'm just kidding.
I'm glad you cut back. I applaud that, and there's further to go. Okay, so it looks like you're breathing very comfortably.
Yes.
Okay, and can I see in your mouth? Can you open your mouth for me?
I was drinking coffee.
That's okay.
Oh.
Okay, thank you.
All right.
All right. Okay, so at this point, I would recommend that you get a COVID test.
Okay.
You have a high likelihood of having it, as it's as contagious as it is. And so, who do you live with in the house?
It's the kids, the dog, my wife.
Okay, so you're going to want to be careful with them, and you're going to want to stay somewhat isolated so that they don't catch anything in case you have it. So if you could be in a room, I won't go into all this, but I will look up where to the closest place to you to get a screening test, and I can write you a prescription and put that in the whiteboard screen there, so you can download it and take it there with you. Definitely call ahead, tell them you think you might have COVID, and wear your mask when you go there, so that you don't risk anybody else catching it. And then I'll put in the whiteboard here some tips for what to do at home with COVID to keep yourself isolated as well as take care of yourself. You're going to want to drink 10 glasses of water or liquids a day. You're going to want to have some Tylenol nearby, and the things you're going to look for we discussed already.
Yeah, that was one question I was going to ask, whether I should take ibuprofen or Tylenol.
You can take them both, and you can take them together even, but you have to take the ibuprofen with food in your stomach to protect your stomach.
Thank you, Dr. Withy.
Do you have any other questions?
So how long does it take for me to get better if I have it?
Well, it's varying. One thing to watch for is when the symptoms go away, and you want to stay in touch with your regular physician. Let them know this is happening, and they can track you. And then if you get blue around the mouth, have trouble breathing, can't walk across the room, feel very disoriented, or are coughing much worse, then I want you to call 911 and go to the hospital.
Okay.
Okay, do you have any more questions?
Nope, think that's it. Thank you.
All right. Okay, does anybody else want to do a telehealth practice visit?
Step right up there, folks. Now, a lot of times what I'll see actually is the patient is using their cell phone. So I'll see something like this.
Yeah.
You know, but that's just the way it is. One of the other things I wanted to mention too, before I forget, is one of the easiest things to do with the telehealth. When you ask people their medicines, they have a hard time saying it. And you can actually just have them hold them up to the screen, and it works really nicely. And a lot of people ask me, you know, about the screen glare. So if you're using a computer like I am, you see I have to wear glasses. So when I have the bright up really bright on the computer, you can see the computer in my glasses. So there's a little button on the keyboard where you can turn that down. You see what happens to my glasses when I turn it down?
Yeah.
So,
there's also an angle you can be at. So I don't have a glare here, but I have a glare here. But it's from the windows over there. So yeah.
Anyways, sorry.
So what I didn't go into was I shared a bunch of documents with you theoretically on the whiteboard. So how to take care of yourself, the prescription.
We have a question.
Okay, just a sec. And I obviously didn't share it in here. I can email it to people or text them to people so that they actually have the prescription with them. Rosie, go ahead.
Okay. Where's the button that takes off the glare?
Sure. So if you look at your, it depends on what kind of computer you have, but if you look up at the top left side of your computer, you see a little star that looks like a little star. You see up there? And you.
Or an apple?
An apple, yeah.
Okay, are you on a Mac? And then that'll turn your screen light up or down.
So let's see. Desktop and screensaver? No, general, I think.
Yeah, on the Windows computer, it's on the keyboard.
Oh yeah, it is. It is.
Yeah.
It's brightness.
Yeah,
No,
that's it.
brightness.
Yeah,
Okay.
People don't
So
know
it's
that button exists, but it's there.
It's next to the escape key.
That's it. It's up
Yeah.
on the upper left.
Yep.
Just
Thank
go
you.
up or down. See, that's an easy one, right?
That's an easy fix. All right. Any other questions? Okay.
Well, it looks like Faith was disconnected and is coming back.
Any questions about any of the things presented today? Was this helpful? Go ahead.
So, was there a question?
I'm not
No,
sure.
I do have a question. We were just saying it was really a good presentation, very explanatory, the way you went over everything. But Raina was wondering, are we able to print out the handout that you presented, the slides today?
Send you the slide.
Yeah. Yeah, and there's the handout. It's called Sample Telemedicine Job Descriptions by the California Telehealth Resource Center, and we'll make sure you get that, because I think when we talk to the AHEC scholars, a lot of them are going to go into various different fields, my understanding, and so they'd be able to sort of page through this and see what would be interesting to them.
If you send me that, I'll send both to everybody now.
Oh, okay. Yes. It's in the shared folder, but I will send it over right now so we don't have any issues there. And I have some other things that I can share, which may be of interest to you.
All
anyway,
right.
yeah,
Excellent.
I'd be happy to do all that.
Did we give too much information on HIPAA or electronic health records or how to do telehealth? Anything too much?
No, it was good. It was perfect.
All right.
Yeah, but I think it was really good. Kelly, I'm wondering if we should have like a survey monkey or something after that we can all give some kind of.
Yeah, that way we can go through your suggestions to make it better. Otherwise, people don't like being put on the spot, and I think that's a really good idea.
Yeah, Raina doesn't mind. No, just kidding.
I was thinking we might want to put the underpants shot sooner.
So everybody saw Batman underwear, right?
Yeah. To make people laugh. And maybe we could have a little video of a old style dial-up phone. The old, when you said we've had this around for 100 years or whatever.
Well, you weren't looking. I noticed when I showed you my phone.
But no, I mean the rotary phone. The rotary
show and tell.
Oh, look, he has one. I want to.
Okay, I wasn't looking. That's impressive.
Yes, that's right. You used to have to go like this. Now, this was even before I was born.
Yeah, that's a long time. I've never touched one. I remember my grandmother's rotary phone, and I showed my kids, and they couldn't use it. They didn't know how. It was great.
Kelly, I just want to ask Auntie Irene, if you can hear me. I want to ask you, because you have a lot of kapuna that you relate to. Auntie, can you hear me, Auntie Irene? I don't know if you know how to unmute, Auntie, but it would be good. Maybe we could get some feedback from you as far as the kapuna, because she has a pool of.
That's the one group, where if they don't have their children or grandchildren to help them, they have a hard time with it.
Yeah. I think she's still on, but I don't think she might be able to unmute. But it would be good, because if we have a survey, I can have her fill it out. Because
she doesn't have audio. Yeah, there's no little phone button.
Yeah, there isn't. Okay.
She can hear. Okay, so we'll send out a survey with that information that you wanted, the PowerPoint and the additional information. And we have 4 more training sessions ready to go. So yeah, hopefully it'll help lots of people. And then there is the follow-up. If the students want to do the 8-hour training, I should put that in the box. Do you have that handy, Louis? The California training. What's it called?
I'm looking for it now, but I'll get it for you. Let me send over the 2 things. I've got a couple of things that I can send you right now.
We could put them in the chat box. And if they want to do that, they can get a certificate as a telehealth coordinator. It's an AHEC certificate, not an accredited. There's no accreditation for this. So, yeah.
So,
but it's a portfolio. It really does.
I'll have to email the documents, Kelly. I can put them in the chat.
That's fine. Say that again, Rosie.
I think it helps the portfolio. I know the host of students that are trying to build, and then for the AHEC scholars.
Right.
And do you think, what was my question? I had a second question. Anyway, I'll remember. And
okay, great. All right, well, we will feel free to give us your feedback when we send the information. and let us know what more we can do to help.
Okay, thank you. Great
We could
presentation.
Yeah, and we can adapt it, or your students can adapt it for Kupuna, however works best. Okay.
Thank you, everybody, for your time and
All right,
attention.
thanks.
Really talking to you.
Bye.
Kelly,
Bye.
can I call